Hello, for this lecture we will discuss drugs for weight loss. And when thinking about those medications, we have to think about who would we want to treat. And this would be the individual with a BMI of 30 or higher. If the patient has a BMI of 25 to 25.9 plus two risk factors such as diabetes, hypertension, those would be indicators. Patients with a waist circumference greater than 40 for men and 35 for women, plus two risk factors. And the goals of treatment with the meds are to be uh, to assist with the weight loss, to be a good aid with the weight loss, but not to replace changing their lifestyle, their eating habits, and um, habits with exercise. So what are treatment modalities? Calorie restriction, exercise, behavior modification, how you think about food, what's your relationship with food. We have drug therapy, and then we have the bariatric surgeries. When we discuss weight loss drugs, there is only one that's been approved for long-term use, and that is orlistat or Xenical, or Ally if you go. That's the OC. Um, the OTC brand is the Ally. So what is orlistat? It is a lipase inhibitor. It acts in the GI tract to reduce the absorption of fat. So when it first came out back in the, let's say, late 90s, 1990s, it was supposed to really be a revolutionary drug because it doesn't have a lot of side effects, and it was supposed to really be a good drug for the diabetic patient because since it did not interfere with a lot of their drugs or have a lot of side effects of their own that were very harmful, um, that we could put the diabetic on this and help them to lose weight, which of course would help their blood sugar and other comorbidities that they usually have as a diabetic, related such as cardiovascular. So it was widely promoted, but the adverse effects that it did have turned out to be um, one of the common ones that it turned out to have really turned patients off, and that is the GI effects. And what it has is a oily discharge, stool-like discharge. So the problem is it made people a little gassy, and they thought they were just passing gas, and there would be this oily discharge. Or when they went to the bathroom, they would have this oily discharge, and it was an orange, oily discharge. So nobody liked that because you never knew when it was going to happen, and just very embarrassing. So that was one of the biggest reasons that it wasn't a big success with patients. There were regimes to try and get it to help with that, such as start off with one pill a day instead of three pills a day, to take Metamucil to help bulk up the stool so that the oily discharge didn't occur, but it didn't help as much for the majority of patients as the manufacturer would have liked. So of course it is still on the market, but it went it went over the counter fairly quickly, and patients that do try it, you have to be very determined, and if you are lucky one to not get that oily discharge as a side effect, then it can be very, very effective. The other side effects, there could be possible liver damage, acute pancreatitis, kidney stones. So those have to be watched for, but considering the med has gone OTC, um, those aren't common side effects. Those are more the rare side effects. The common one, of course, again, is the oily discharge. You do have to watch for interactions if the patient is on warfarin or takes levothyroxine, and also the fat soluble vitamins because of how this drug works. So they may have to take supplements on those vitamins. The next med is locazepam or Belviq. It's one of our newer medications. It is approved for chronic weight loss therapy. It suppresses the appetite and creates a sense of satiety by activating the hypothalamic and mesolimbic pathways in the brain to control appetite. Um, the only absolute contraindications would be during pregnancy and breastfeeding. And interactions, of course, because it is a serotonin product, you have to be careful if the patient is on other medications for, say, depression, because of you have to be careful of not um, inducing serotonin syndrome from too much serotonin, and also levothyroxine can cause a hyperglycemic episode. Other miscellaneous anti-appetite suppressants include a use of amphetamines, which are not FDA approved because, of course, they have the higher um, abuse potential. So those are not acceptable to use for weight loss. Non-amphetamine, but they are amphetamine-like in how they suppress the appetite through the CNS stimulation, would be your phentermine, which is very, very popular. All of the weight loss clinics that you see around everywhere are using phentermine. It's been around since the 1950s, so it is relatively safe. It is not a Schedule II med as an amphetamine would be, like your Adderall or Ritalin. It is considered a Schedule 3, or they're 3s and 4s on the schedule. And the Bontril, which is the diethylpropion, those are used very popularly. When you give those meds, of course, you're going to screen for uncontrolled hypertension, and especially any history of drug abuse, because, of course, these still are scheduled meds, so they have the potential for abuse, just not like a Schedule II. So you have to be careful in screening out these patients, especially with any drug history or drug abuse, and of course with any cardiac problems. A note on drugs for weight loss. Weight loss drugs share a disturbing history. They receive regulatory approval, achieve widespread use, and then are withdrawn owing to discovery of serious side effects. So that has happened with a few of the newer. The Meridian was one that came out, was very widely publicized and used, and then this was probably over maybe 15 years ago. And then what happened is the serious side effects were discovered, and it had to be taken off the market. Um, and they are they do work, and that's the problem. They work for the patients. Patients like it. Um, they're instituted by everyone because everybody's all in, businesses or in the health profession. We're looking at ways to help patients to maintain a healthier weight so that overall health is improved. So these meds are put into use as soon as they're FDA approved, but then we then find out about the long-term side effects. Um, if you were uh, if you're older, you remember the fen-phen and how the phentermine that we still use at all the weight loss clinics is still on the market. That was part of the fen-phen. The fenfluramine was the drug that was taken off of the Pondiment. So that was the one that was causing irreversible pulmonary hypertension. So that was another one that was extremely popular, back in the 90s, again in the 1990s, and had to be taken off the market after that was discovered. Also, ephedra has been banned from use. Not that you still can't find it, but that is not widely used anymore as a weight loss medication. So we'll move on to the questions. Patients taking orlistat or Zentacal for weight loss. Which statement by the patient indicates an understanding of teaching? And the answer here would be C, that they need to take a multivitamin 2 hours after because of the interaction with the fat-soluble vitamins. 2, which is the most common adverse effects experienced by somebody on Zentacal? And the answer is C, the fecal incontinence, the oily stools. And question 3, the last question, the patient tells the patient tells the nurse that they would like to start taking orlistat. What is the most important to obtain in the patient's medication list if they're also prescribed? And that would be D, warfarin. So that is it for this lecture presentation. Thank you very much.